Hi, good morning. My name is Dr. Vicky Cleak and I'm a consultant psychiatrist with a special interest in adult ADHD. Today we're going to talk about the difficulties you may have had in getting a diagnosis of ADHD. I know that there are significant challenges in obtaining a diagnosis and seeing an appropriately skilled professional, and to do that either within the NHS or even privately now. We'll also look at how actually seeking a diagnosis of ADHD, with all the barriers there are to doing so, can be particularly difficult. It can be a real challenge to get help for ADHD and find the right professional who understands all of the potential comorbidities and be able to manage those with you safely. ADHD can be particularly challenging to diagnose accurately when you have other comorbidities. I think there can be an expectation that when you seek a diagnosis of ADHD in adulthood, that because you've coped for so long already, there will be no benefits to obtaining a diagnosis. However, if you are bright and you have a number of social structures around you that have helped up to now with your ADHD, then you may well have coped. It's only when you transition into a new part of life, for example, having to balance career around having children and perhaps caring for elderly parents, that the ADHD can become more difficult to manage. Adding to the fact that when women have all of those competing aspects, that can be just the time when you transition into perimenopause, and that we know can be a bit of a disaster for ADHD symptoms in making them even more prominent. And if you go and see a clinician who doesn't appreciate that, is not looking out for that, then you may not actually get anywhere near your optimization of treatment. So let's think about the journey you took in getting your diagnosis. So when people with ADHD come to see me, often there's been a number of years in terms of them thinking about going to get a diagnosis. Some people had a diagnosis when they were children, and they may or may not have started some treatment at that point, but they never continued with that, and they are coming back because they're facing new challenges in their life which they think might be down to their ADHD symptoms. And other people have read an article in the newspaper, had a discussion with someone close to them who said, yes, that sounds very much like you, and the dialogue happens where they start thinking, well, it seems that everybody else thought I had ADHD, but no one mentioned it, so maybe I'll go and actually seek some help for this, or find out whether that is in fact the case. People often go through a series of steps towards from starting to think about, could this be something that I might need help for, these symptoms. They may not even know that it is ADHD, and they may have sometimes sought help from a GP for anxiety or low mood, when actually the underlying cause is ADHD. So all of this journey between thinking you've got difficulties to actually seeking appropriate assessment from a professional and then getting a diagnosis can occur for different people over a wide variety of time. But it usually starts with this pre-contemplation. So pre-contemplation where maybe I've got some difficulties, but particularly if you've got ADHD, you may be distracted by other things, other activities, other people. And so although occasionally you think, gosh, why has this gone wrong for me? Why have I got another parking ticket? Why have I missed yet again a children's party I should have dropped my kids off for? Why have I been shouted at by my boss for not getting the work done on time? That pre-contemplation, it's in the back of your head, but you haven't actually done anything about it, can then become that contemplation where you're sitting in bed thinking, actually, I do have a difficulty. I think I need to seek some help for it. Yeah, and then again, some more time might go by before determination, where you think, do you know what, I'm going to go and see someone about this. I'm going to Google who can I go and see. I'm going to ask some friends who, if they know somebody who can make an assessment or diagnosis for ADHD, or you might Google online and to find a doctor or speak to your GP, and then actually picking up the phone, sending an email. That's the action where you are going to get some help. So I'm asking you today to think about what for you first triggered the idea that you may have ADHD and that you wanted to seek some help or support around that. Was it your friends and family making a suggestion? Was it that you'd presented to another professional like GP for problems with your sleep, anxiety, and actually they steered you towards that instead? Or did you look up on the internet and Google, why have I got these difficulties? And found that actually there was a self-assessment, an ASRS 18 screening tool that you could do, and it said yes, high likelihood that that might be one of your difficulties. So what was it for you that first triggered the idea that you might have ADHD? And then in terms of your determination, what action did you take? Who did you go and see? So we know that access to your GP is becoming increasingly challenging. Nowadays, you can't just ring up at 8 o'clock necessarily. You might have to fill in an online form to actually be able to get anywhere near your GP. And if you do see your GP, they may or may not be sympathetic to the diagnosis. Amazingly, you can become a GP without any specific training outside of medical school in mental health, which I find quite incredible given the fact the majority of their patients will have associated mental health difficulties. It can really be a bit of a lottery who you see in terms of your GP and whether you get signposted to the right person, because most GPs won't feel comfortable with making a diagnosis of ADHD and as well as treating it. If you do see a GP, you nowadays can possibly be referred either locally or through Right to Choose to a provider that has a shorter waiting list. Most of those are online providers, but if you go through Right to Choose, really your GP should actually be saying to you that they're willing to take over the prescribing once you've had a diagnosis and have been established on treatment. Or have you decided to circumvent the long waiting lists and go straight for private? I always say to patients to do both in tandem, because we know the waiting lists of the NHS are large, but if you go privately, you don't want to waste that place on the NHS list, although you may end up having to be repeatedly assessed, which is not good use of resources in my view, but that's sometimes what is insisted. It does mean that once the NHS accepts that you've got ADHD and are happy to take over the treatment, that the taxpayer will be paying for the medication, which can be a considerable cost rather than you paying that yourself. In terms of cost of medications for ADHD, the actual medication for adult first line medication is around about £100 a month, and that obviously doesn't include the costs of seeing a doctor or even the prescription being written, which can be an added cost up to £40 a time, and that will be on a monthly basis. And what barriers did you come up against in getting a diagnosis of ADHD? Sometimes those barriers can be internal in terms of the ADHD, so putting it off, that procrastination, making an appointment, but if it's many months in advance, you may forget about it. You don't notice it until the day before in your diary, but then you find you've double booked. A common thing that happens with people with ADHD. So you might change your mind. So there may be lots of reasons why internally you haven't actually, it's taken you a while to get help. External barriers, as we said already, there may be issues around finances. You may find that there are long waiting lists. And there may be other practical difficulties. If you've got an online company, you need to have a computer, and you need to be in a most assessments for ADHD take around 2 hours, so that needs to come out of your own time, perhaps during, if it's 9 to 5, during your work time. So that might be a bit of a barrier to seeking an ADHD diagnosis. So this is the point where we sort of draw it all together and have a real reflect on how it felt going to get that diagnosis. Sometimes it can feel like a real fight, which when you've got ADHD and all the other things going on in your life can be very difficult and challenging. But I guess that also shows, if you've overcome that you've got resilience and grit, and that if you've got treatment and it's successful, it can really, really be worth it. So what has been your experience so far in seeking a diagnosis? What was the connection with the person you saw like? Did they really understand you, listen to all your difficulties? Did they explain ADHD in a way that really put the jigsaw pieces of what had been going on in your life together to make a picture you could understand? Did they answer all your questions in a way that made you feel empowered so that you could make choices that were right for you? How did you manage and overcome the difficulties you had? And what does that say about you? What positive things does that say about you? So I always say to patients when I've made the diagnosis of ADHD that getting a diagnosis of ADHD is not the destination. It's actually usually the first step of a journey in a new direction, but one that is going to be perhaps more successful, more empowering, more positive. Thinking about how and when you got the diagnosis and how that fits into your life and the changes that you're going to make going forward, that can be really, really quite positive. So in summary, getting a diagnosis of ADHD is a mixed experience. It can be a significant challenge, but I would say it's one that's really worth it. Even if you decide that medication is not a thing you want to consider, getting a diagnosis and understanding more about yourself, why you do things, why you might sometimes have difficulties, and being able to explain that to family and friends can be super, super empowering and make a significant difference to your well-being and your functioning and your relationships with others. So given all the difficulties we've discussed in obtaining a diagnosis of ADHD, both internally and externally, I think if you have managed to do so, then you should give yourself a big pat on the back and think about how well you've done. It's the first step of a new journey, but a journey that will enrich you and make your life better, as well as understand all the things that perhaps have been difficult for you, maybe gone wrong in the past. Take care. I look forward to seeing you at the next video.